Unfortunately, there is no study comparing different diets, so we cannot really say which one would be better. We don't know if an anti-inflammatory diet would be helpful. However, we do recommend maintaining healthy weight because that is beneficial both for the heart but also for the muscles, because the less weight the muscles have to carry, the less strain we put on them. We see that countries with higher sun exposure have a higher increase of dermatomyositis. So we know there is a link between UV light and dermatomyositis. We recommend all our patients use broad spectrum sunscreen, and the higher the SPF the better because they block the UV light. Long sleeved clothes and a hat with a broad rim so that none of their skin is exposed directly to the sun. They also need sunscreen even if they're working inside. Whenever there is a window, sun goes through it, even when we don't feel it. Another thing to be aware of is that fluorescent light that we use for the rooms, that can also cause an exacerbation of the skin rash. So we usually recommend our patients to go on with their everyday life, if they can, so that they have the sensation nothing has changed. However, we also recommend that they avoid any type of stress, because a recent study had shown that generally in rheumatic diseases, half of the patients that had a flare of the disease 3 months before, they had a stressful event in their lives, like a divorce, job loss, death in the family. It is difficult to control stress. But on the other hand, more and more studies show that maybe mindfulness can be helpful in reducing the stress. So in general, we do not recommend rest. And of course, that depends also on the severity of the disease. If the patient is very weak or has a significant skin rash, of course, we recommend that they rest and take their time as much as they need.